Hi there, this is Sue Stone. I am here to share with you a project that was conducted in the intermediate care program called Joy Forums, a program to improve nurse engagement and curtail attrition. A little background, I was in the process of getting my doctorate in nursing and was looking for a project, and at the time the NDNQI survey results came out in 2020, and I found that the ICP joy and meaning scores were in the 10th percentile. In addition, we were seeing more turnover than we had ever in the past, and we were facing expansion, which we thought at the time was going to be in 2023. So as a nurse leader, this was really concerning because you're looking at expansion and yet people are leaving and they're not happy in their jobs. And I did a literature review and looked at joy and its impact on nurse retention and nurse outcomes. I was happy to see that I did not need to focus on burnout, but I could take a positive spin on things. And looking at joy, it had positive impacts on job satisfaction, safety, quality of care, and on patient experience, all very important. I in particularly looked at the Institute of Healthcare Improvement's framework for improving joy at work and kind of used that as a model for the work that I was going to do on the unit. So I proposed that I was going to improve joy scores by 10% and reduce turnover by 10% by the end of August in 2022. How did this happen? So I had a survey, it was Red Cap Joy survey, it was 10 questions, very quick, offered it out to the staff, had a good turnout, and from those results, I used them as my baseline, and I found that joy and meaning scores before the forum were at 3.52, and that job satisfactions were at 3.22. These were on a scale of 5. Then I started telling the staff about the importance of joy and getting some buy-in for that. And so we had our first joy meeting where we talked about why joy is important, the impact that it has on satisfaction, safety, quality, and patient experience. And then we started exploring the important questions, which is what is important to the staff? That's the real driver behind what makes a good day and a bad day, is how people are experiencing it, what brings them joy, are they able to attain that joy in their shifts. After that, we made a fishbone with people that found barriers to being able to experience joy at work. And we took that fishbone and we really analyzed each of the pots for information on what could be done. From the fishbone, we then took interventions that people had raised and we put them into this effort yield chart, which you can see on the poster, and looked at things that maybe had high impact and weren't going to take a lot of effort, and kind of across the map with the high effort, high impact, low impact, low effort. And then we tried to avoid the low impact, high effort things as much as we could. So there were 12 forums in 8 months, and in those forums, we had 14 projects that were completed. And the projects were run by, so in each forum, the nurses would pick what 2 topics maybe we wanted to cover for the next month. And they would make a little team and I would help support them if they needed it in terms of, anything that I could provide for them. But pretty much the staff pulled together a little team and found ways to address different issues. And you can see the entire list there. We started paying for meetings, which I think everybody ended up doing at some point. We made admission packets to make it easier for people to share the same messages with each family. We started the resource nurse and really kind of worked within that role to make it really fit our unit. And those are just, a few things that we have addressed. After, all these meetings, I did another survey and also had a good turnout of people to respond to that. And I found an increase in joy meaning scores from 3.52 to 3.91, which was a significant result. And the job satisfaction scores also went from 3.22 to 3.86, which was also significant. And turnover went from 20% down to 15%. And this was facing a sudden increase in size. We doubled in size in 2022 as opposed to 2023, which brought a lot of angst to people as well. And whenever changes like that happen, you expect that there'll be higher turnover. So I was really expecting a flat turnover, and I would have been happy with that. So to see it improved was great. The biggest learnings, I would say, from all of this is for any project, you need buy-in of your staff, and our staff has been wonderful at really engaging in this process. The most important point as a leader is to really go to the roots and listen to your staff. Go ask them what matters to them, because what matters to them could be very different from what matters to you, and it changes all the time. Every month, the things that rise to the top are different than the month before. We fix something, and then there's always something else. So it is a cycle, and it goes with, the feelings on the floor and the stuff that's going on the floor. And then once you identify those things, strategize on how to address it. Pull those teams together of nurses to really own and engage in making that process improvement. Because when you own it, it's yours and it means a lot and it gets done. And we've seen anecdotally much better morale on the unit and just people really engaged in the process and trying to do things better. So I do think that even though this was a small unit when I did this project, I do think that this is something that could span throughout the organization. It's a really simple idea, and just taking a time period once a month to really listen to your staff and help empower them to bring change. And you will see some positive impacts for sure. If you have any questions, always feel free to reach out to me. Thank you.